Austria is warning people unvaccinated against COVID-19 that they could be put into lockdown if hospital intensive care units come under too much strain. Those who have received their shots or recovered from the virus will be exempt from any new lockdown. The country's chancellor warned of a pandemic of the unprotected as infection numbers in Austria rise. Around 62% of eligible people have been fully vaccinated, but the campaign has stalled. After crisis meeting, Chancellor Alexander Schallenberg said he hopes the plan will send a message.
I would like to emphasise very clearly the decisions taken today, the further steps, have I emphasise no effect on the vaccinated, on the people who are protected. We are therefore continuing the course the federal government embarked upon in the summer. There is no doubt there will be no lockdown for protected, vaccinated people.
For more on this now, I'm going to be talking to Carrie Skyring, a freelance journalist in Vienna. Carrie, these measures set up a clear division of Austrian society. How's the public reacting?
Well, of course, those who are vaccinated and believe in vaccination are favouring this greatly. Those who, for some reason, do not want to be vaccinated will be protesting. There have been protests in the past year, and one can see that that will increase in the future. But what seems to have happened is that at around the 70% double vaccinated mark, that seems to have stalled, and the government seems to believe there's about 30% who really don't want to be vaccinated or for some reason haven't been vaccinated, and they really want to push this vaccination level up. It will be, as you intimated there, rather divisive.
I wonder whether you've answered my second question. I just want to be very clear about this. Why is the government relying on such tough, potentially unpopular measures rather than promoting vaccination more?
It has promoted vaccination, from where I'm standing, reasonably well. And the information they're getting is that that's not working with the around 30%, up to 30% of the population who simply don't believe in being vaccinated. So they have to get tough is the message that was given in that press conference yesterday that you've referred to. And getting tough means basically those not vaccinated will go into lockdown. Now, this is going to be really difficult because in a household, you will have some people leaving that household who are vaccinated and others unvaccinated in that household who will not be able to leave except in the usual circumstances, such as for medical appointments or to obtain essential supplies or exercise. So they will be going back to the old circumstances of lockdown at a certain point when the number of intensive beds reaches a certain number that are occupied, reaches a certain number.
It sounds very much like you're saying the government feels it has no other choice at this point. How bad is the corona situation in the hospitals in particular?
At the moment, it's manageable, but it's rapidly approaching the point where there will be serious difficulties treating other patients apart from the coronavirus patients. And they've actually set this out in a number of steps. When the number of occupied beds reaches 30%, for instance, that's around 600 of the intensive care beds in Austria, then that final measure of the lockdown for the unvaccinated will come into play. And apart from that, I think what the government has done is locked itself into a bit of a position here. Some time ago, the previous Chancellor, Kurz, promised that there would be no more lockdowns for the vaccinated. So they're really following up on that promise because the numbers are rising in a concerning way. Austria is probably twice as many infections per head of population as Germany at the moment. The rolling 7-day number is about 230, more than twice Germany's infection rate.
Understood. That's a journalist, Carrie Skyring. Many, many thanks. Many countries in Eastern Europe are already dealing with overcrowded hospitals because of the coronavirus. New infections and deaths in Ukraine are the highest they've been since the beginning of the pandemic. A low vaccination rate means the population remains especially vulnerable to severe infections, and the government has been forced to introduce new restrictions on public life in response.
Trying to console another gravely ill patient. People suffering from COVID's Delta variant have practically filled this hospital west of Kiev. Doctors expect even more cases, and they know why. The severity of the course of the disease is certainly higher, and it's more aggressive than last year. Unfortunately, the patients in our department are not vaccinated. Only 15% of Ukrainians are fully vaccinated against the coronavirus, one of Europe's lowest rates. After experiencing the disease, some people here say they should have acted differently. People need to get into their heads that they need to take care of themselves and get vaccinated because it's really scary. I didn't believe it either. As new cases and deaths from the disease reach new heights in Ukraine, more people are getting their coronavirus shots, but not all have come voluntarily. Since it's become compulsory, we have no choice, otherwise we wouldn't. Ukraine now requires many state employees, including teachers, to be vaccinated against the virus. And to ride public transport, people now have to be either vaccinated or tested before traveling. But again, resentment against the measures is widespread. It should be a person's choice to get vaccinated. According to the Constitution, we have the right to choose, don't we? So my attitude is entirely negative. To get around the restrictions, many Ukrainians have been buying fake vaccination documents. Yet another problem for a country already struggling with the pandemic.